Great pleasure now to introduce to you, to say a few words of welcome, the CEO of the Lucille Packard Children's Hospital, Stanford. Please welcome our host for tonight, Mr. Chris Dawes.
Thank you very much, Bob. I really appreciate the opportunity to be here this evening. I'm the CEO of Lucille Packard Children's Hospital, which is also Stanford Children's Health, which is a name that we're beginning to use more frequently now because we've gone beyond the walls of the Stanford campus. I just can't tell you how much we are excited about being here. We spent a long time looking at a lot of communities to figure out where we can create a very unique environment for children. And we were just delighted as we came through Emeryville and looked at lots of buildings and ended up with this building. We're just very excited. What we like about Emeryville is it's such a wonderful small community. It's very accessible by those, obviously the freeway, but also those in Berkeley and Oakland and Piedmont and the whole community around here. And also, I think most importantly to us is that we want to become part of this community. We're not just here, Monday through Friday, 8 to 5. In fact, our hours are a little bit longer than that. But we're actually here to provide services, but we want to be part of this community. We are a children's and obstetric organization. That's all we focus on is children and pregnant women. And we are here to be a part of this community. That means we want to provide services to this community, not only those that are provided here, but everything from safety, car safety, and so forth. So we want to be integrated into your schools, integrated into your community. So we have a staff of people led by Sherry Sager, who focuses on those kinds of services, and we will be very much a part of this. So again, thank you very much for this very, very warm welcome. And I'm now going to turn it over to my colleague, Dr. Ken Cox, who's our Chief Medical Officer, who can give you just a quick overview of some of the services that are here and why we think this is a very special place.
Thank you, Chris. I really appreciated being here and I'm impressed with the facility. I think this is the kind of facility that should be our trademark in terms of the way we provide services to our community and to the children and the families. I think the thing that we have done through the Children's Hospital is felt that we need to go out and be in the community and provide services to the community because we have great physicians, and here we're beginning with some outstanding programs in terms of orthopedics, cardiology, GI, neurology, and we have several others that we're thinking of bringing into the community. And these are top-notch doctors, and I think you're going to get innovation in the care of your children. And an example is the EOS system. Here we have an X-ray system that gives you three-dimensional views, and it's low radiation. And so those are the kind of innovative things that we'll bring to this community, and I think we'll deliver the kind of care that families will appreciate. I think the new healthcare system isn't that you have to drive 6 hours to see your doctor. The new healthcare system is we're there in the community for you. And so this is an example of what we plan to do as a children's hospital, is be here and provide the services for you here. And then we need feedback as to what you want and what we can do better. So thank you very much for coming tonight.
Thank you, Dr. Cox, very much. And as I look around the room, and we